Welcome everyone to the League of California Cities After the Emergency Navigating FEMA Reimbursement Process. My name is Megan McKelvey and I'm the Manager of Department and Membership Services for the League. This is our 18th webinar on the COVID-19 series. As you know, COVID-19 has rapidly changed the way that cities operate. And in order to meet these moments, we have produced this webinar series for you to learn from each other. So please ask questions to our speakers. Before we get started, next slide, let's do a few housekeeping notes. You are all muted upon entry. If you are planning to speak, please make sure that your audio setting is connected, and you can do that through the audio setting function. This webinar will be recorded, and you can actually find this webinar and other webinars that we've done on COVID-19 at the League's website, cacities.org/coronavirus. Today, our speakers are taking two ways to ask questions. First, you can raise your hand and verbally ask a question or comment. Second, you can use the Q&A button to type in your questions. If you have any questions for League staff, please use the chat function and we will get you that information. Next slide, for those of you who have participated in our webinar series, you know that I'm usually the moderator. But today we have an amazing guest moderator, Derek Dolphy, our legislative representative for the League. Derek?
Thank you so much, Megan, and welcome to all of you who are on the line, and thank you to our wonderful speakers and to Megan for being here today and presenting you this very timely and hopefully very useful webinar for you. As Megan mentioned, this is a COVID-19 webinar series that we've been doing, the 18th one there. This webinar today is going to be looking at something very important, which is navigating the FEMA reimbursement process. So as we've all heard from the federal government and our partners at FEMA, disaster response and recovery is locally executed, state managed, and federally supported. So today we're going to be hearing from both the FEMA and California Office of Emergency Services, also known as Cal-OES, to see how cities can navigate through the reimbursement process after an emergency has happened. You know, we at the League want to make sure that we're giving you every tool that we possibly can in the toolbox to make sure that you're be able to come back stronger and more resilient after a disaster. So this webinar hopefully will give you some insight and some clues and some tips into how to navigate that process of reimbursement and how you can interact with both Cal-OES and FEMA on that front. Additionally, as Megan has said, there's numerous webinars that we've done on this topic of COVID-19 in these very unprecedented times. I would encourage all of you, if you're interested in going back and watching some of these webinars, hearing more about various aspects of things that cities can do or resources that cities have available to them. You can find a recording of all of these webinars at www.cacities.org/coronavirus. As Megan said, this is the 18th so far, and there's a whole wide range of topics there, including things like, you know, how does a city make an emergency order and many other topics. So definitely want to make a plug for that as well. As many of you know, a couple opening comments before I introduce our wonderful speakers today. The League has made strengthening community and disaster preparedness and resiliency a priority this year, obviously with everything going on, both with COVID-19 and other disasters, natural and man-made disasters going on there as well. We're happy to be working with both our state and federal partners to bring you this information, as well as working with many of you in our city managers department to craft and provide ideas and tools for cities to really help them through both the pre, during, and post-disaster stages. I do want to give another plug, if you're so inclined, about some of our educational opportunities. We are having another webinar with our wonderful partners at Cal-OES coming up on June 18th for our Mayors and Council Members Executive Forum. It is going to be about the utility-initiated power shutdowns and how both the state, counties, and cities can work together during one of those events and when the power is turned off, and who is responsible for what and how we can all work together to make sure that we get through it as best we can. Lastly, I will mention that on this front of COVID-19, the League has been extremely active trying to advocate as much as we humanly can for you as cities, trying to get direct and flexible funding from both the federal government and the state government to fill the close to $7 billion budgetary shortfall that cities are facing in California over the next 2 fiscal years. So the League has been advocating to get CARES Act dollars from the state level, as well as seeing how we can work with our federal partners, including the National League of Cities, to see if there are any more economic stimulus dollars that the federal government can provide directly to cities that are very much on the front lines and need these direct and flexible dollars. So if you're curious about that and want to learn more, we do have a support local recovery campaign that we have kicked off with over 200 business, nonprofit, labor organizations all signed on, and numerous cities. So if your city is interested in joining the chorus of the League and many other cities around the state in trying to advocate for these direct and flexible spending dollars for COVID-19, please check out supportlocalrecovery.org and see how you can sign up and join many of us advocating for more funding for you in city land. So with that, I will introduce our great speakers that we have today. We have 2 speakers from Cal OES and 2 speakers from FEMA. Our speakers are Ryan Buras, Deputy Director of Recovery from Cal OES, and John Catching, Program Manager for Disaster Closeouts at Cal OES. We also have from FEMA, Robert Pesapane, who is the Recovery Division Director, and Grace Tabara, who is Public Assistance Specialist. So with that, I'm going to kick it over to them. And please, as Megan said, if you have any comments or questions, please use the chat feature, or at the appropriate time at the end, we will be accepting verbal questions if you do the raise your hand feature at the bottom of the screen. So with that, I will pass it over to Cal OES. Please take it away.
Thank you. Good afternoon, everyone. I'm just going to give a brief overview of where we are. I'm going to turn it over to my partner, John Catching, to go over actually the program in general. I would like to say a few things. I think, Derek, that was a great overview. I think CARES Act key. Additional funding would be great. So let us know how we can help you all push that as well. Going, directly to the cities and counties is, crucial for all of us. In regards to money, we do have an expedited project worksheet process, and John and his team has been expediting funds to the locals for projects such as testing, non-congregate shelter, great plates, and we're still doing that. So if there's cities and counties that need that money up front, which I'm sure each given day is more pressing, particularly on money, please let us know. Our team is here ready to work with you all. I would say this is different than probably any other incident. Just for instance, John Catching works in closeout. He does not work in public assistance. This is all Category B work. It's all going to be completed work. It's all closeout work. So one thing I wanted to do here was not use the public assistance team, which is generally there for a year or 2 or 3 working through permanent work. I really want to bring in a closeout team to not only help people get money in now, but John and his team is and will be aware of every project that's in the system. My goal is, when all this is over, is to have everything entered, not only entered into the FEMA portal, but sent to FEMA, for reimbursement by the end of next fiscal year. So it's very aggressive. We have projects that's been open, for many, many years for many different issues and problems. But for this event, since it's completed work, I don't want to wait. We can't wait. Money, with the state shutdown and the nation shutdown, tax dollars are critical, and so we have to get the money out on the street. So a big thing different here is the pots of money we're getting. HCD, HUD just announced, $200+ million going to HCD for to assist the state with homelessness programs. We have CARES Act. We have additional monies that may be going out. We have Category B FEMA public assistance, and how to navigate that window is going to be crucial. And how to flex the way you spend CARES Act money, which is 100%, and lean on the FEMA public assistance program as needed with that cost share dollars is going to be key as well. So we're very flexible with that, and we want to be very innovative and help everyone make sure that gets done accordingly. Working with FEMA has been great. I know FEMA's on going to be presenting today as well. I can say, we just got great plates extension about an hour ago, and that's through July 10th. I'll be having my team draft up a very simple paragraph to all the people that either providing them as currently or have letters of intent to do so. And one thing in that, I want to thank everyone that's participating with that program. as of yesterday, we've already delivered over 1 million meals since April 10th. And, you know, that's just a remarkable effort in a program that wasn't even in existence in the month of April. That's, you know, a testament of you all, the locals. This is where things start. This is where things end. So I cannot thank you enough for helping us move that along. With that, I'm going to turn it over to John. I may step away for a little bit just to go to some meetings. John Keshin's here. He can answer all the questions. There may be, I'm sure there's be some questions on CDAA. So John, I'll just take that on right now. CDAA is definitely of interest. We did turn that on for a great place. But I will say, just like any other incident, just when you get your costs done, just go ahead and submit the request to the state. We'll look at it like we do any other incident and event. Yes, as you all aware, the state is, you know, $54 billion in the hole now, but that doesn't mean that we turn our backs and don't support disasters. OES is valued, and it's one of the key agencies here with the governor's office and his team, and he works with us every single day. And I'm confident that, you know, we'll be able to not only assist you all with this particular incident, with the civil unrest that's going through, getting some SBA claims moved on, but also with past disasters. We just we'll be awarding the tree contract to remove trees up in Butte County, and we're preparing for fire season. So there's a lot of things moving forward. We're not focusing on one thing. We can't focus on one thing. You all deserve more from us, and we're going to dedicate 100% of our time and effort to that. So with that, I'm going to turn it over to John.
Thank you, Ryan. Much appreciated. So I think we can go on.
Sorry about that, didn't realize. Oops. Sorry, I need something here to unmute. There we go. Okay, that seems better now. We'll start with a disaster overview for the COVID-19 event for the state of California. It was named DR 4482. Governor declared the state of emergency on March 4th, and the president declared this a major disaster on March 22nd, which set our incident period beginning January 20th of 2020, and it's continuing. There is not currently an end date to this incident. We will be told, FEMA will work with their national HQ in order to determine when that date is going to end. They'll let us know, and that's when we'll have an idea of what period of time costs will be eligible for. The assistance available, so public assistance for this event is limited to Category B, which is emergency protective measures, and some direct federal assistance. And we also have individual assistance for crisis counseling provided by FEMA in this case. All of our counties are designated, which, next slide please, is demonstrated very easily here in this next slide. It's the entire state. First time we've had all 58 counties declared for a state event. Lots of challenges administratively, but we're doing our best, and certainly want to work with everybody in any way possible to make this program go as smoothly as we can. Next slide, please. So the Public Assistance Program, it's a federal program run by FEMA. We are the recipient of the grant funds who pass them through to our subrecipients, which are our locals and any other eligible organizations. It could be private nonprofits, other governmental entities, cities, counties, community college districts, school districts, that type of thing. Again, and you'll hear us emphasize this multiple times through here, assistance is only for emergency protective measures. We do have some fact sheets that FEMA has provided us that gives examples of eligible emergency protective measures for this event. Highly advise everyone to look at it if you have questions or if your staff are working on that. And FEMA will cover no less than 75% of the cost for eligible work. That's the minimum cost share associated with this program. So next slide, and I think we're passing it on to our FEMA partners.
All right, Robert here. Hopefully everybody can hear me. I'm off mute successfully. First, I want to thank Cal OAS, John and Ryan for their partnership throughout the COVID-19 operations. Certainly has been a lesson learned all around in terms of the using the public assistance program for a nationwide pandemic, and first time, as you alluded to, having all the counties declared at one time makes it a unique challenge for the federal government and the state in terms of administering recovery programs here. But I think we're getting it done here in California, and that's through the partnerships that we've developed, sadly, over many disasters in the last few years here in the state, most notably with the wildland fires. And I also want to thank the League of Cities and Towns for hosting this webinar and getting out the message on public assistance reimbursement, which is, I think, going to be critical for those who need funding and try to navigate through the different funding opportunities that are available to cities and towns. So John mentioned in public assistance, we have multiple categories of work, but for this event, this disaster, we only have one category of work authorized, and that's category B, which is emergency protective measures. Not really complicated category, and as Ryan Buras had mentioned, it's a lot of things that you're already incurring costs for, work already performed, and now we're just going to capture the paperwork, look through it, and try to quickly reimburse that. And we are leading the nation in public assistance reimbursement. When I checked before we jumped on the webinar, for expedited projects, and if you don't know what that means, it means if you have anticipated cost, let's just say EOC costs, and you can project that out for 30 days, FEMA will look at that projected cost and give you half the money up front in expedited fashion. So right now, with expedited projects that we have obligated and in the system working, we're about 1.5 billion for the state of California. I think we are over half the now obligations for the entire country, and that's because of the partnership between us and Cal OAS, and of course the cities and towns for giving us the getting into the grants management system and providing us the necessary documentation to move those grants forward. So really, it's a collaborative partnership all around. Again, for category B, it's those actions that should be taken in the direction of public health officials. That's kind of a key nuance in this disaster. So a lot of things that that we're going to look at in terms of reimburse has to be directed by a public health official, either a city or a county level. And so we'll be looking at that as one of the criteria for emergency protective measures that you undertake from the COVID operation. Next slide, or do I move the slide? Okay, great, thank you. So these are the typical things that we're going to be reimbursing for category B. I'm sure many, if not all, have their emergency operations centers activated at this time and have been probably running 24/7 or now starting to work modified shifts. All that is eligible costs that you're incurring to run those emergency operations centers related to the COVID event. Of course, the purchase of protective equipment, personal protective equipment, PPE, is another eligible reimbursable expense, and we have many of those projects in the system that we're reimbursing. Emergency medical care, and we work through the alternate care sites, the ACS sites that we built in collaboration with the state of California. All those and the wraparound services for the alternate care sites are eligible under category B, which are also considered temporary facilities or public hospitals that are being expanded, or clinics, again, are all category B eligible for reimbursement. And then testing associated with medical care in those facilities is also eligible. We've also approved non-congregate sheltering here in the state of California, and so that's, I believe, state managed and being administered locally in the counties and cities. We're working through reimbursement from the non-congregate sheltering, which is really hotel, motel type programs that we're putting those who've been exposed or COVID positive patients into those facilities, as not to put them in a congregate care setting. So congregate care means like a gymnasium, like we would do for a large scale wildland fire. We don't want to do that because that'll increase the spread. So we approved non-congregate sheltering statewide for California. The purchase of commodities and food. Talked about the Great Plates program. That's within our policy, how we got to approve emergency food distribution to the most vulnerable populations. We just approved another 30-day extension request for the state of California. That'll take us out, I believe, to July 10th. And then the state, of course, will reassess its need and come back to FEMA, whether they need to continue that program. So we look at that emergency feeding program 30-day intervals, and that's because it's part of our policy. We can't approve that, so we have to re-examine the need for emergency food distribution every 30 days. Any security and law enforcement that may be needed, we're funding those activities. So it could be for the non-congregate care settings, it could be for the alternate care sites. That's all eligible expense. And then any unique communication with health and safety information to the public. So any kind of outreach campaigns to stop the spread of COVID-19 or mitigation best practices, and all that public information type elements are reimbursed through public assistance. So those are kind of the highlights. Grace, as we get into the presentation, we'll talk about the application process with John on how you get access to FEMA funding. And then the really important point that I'm sure Grace and John will also touch on, and we'll get probably in the Q&A, is duplication of benefits. So as Ryan mentioned, there are a number of programs turned on through the CARES Act and other supplemental funding opportunities. We have to make sure if another federal agency is funding an activity, that you do not come to FEMA for that, as if we accidentally fund that, which we're working hard not to do that, we're going to have to navigate that at closeout, and we don't want to do that. We don't want to have to deobligate or shift funds. So we want to make sure as we read through the CARES Act, and we have a whole team here at Region 9 dedicated working with our federal interagency partners to ensure what funding they have available. And some of it is new programs that they're turned on. So it's taking a little bit of time for the federal interagency partners to kind of turn around their funding opportunity notices. And so with FEMA, we're pretty fast at getting out funding and working through those projects. So we're out in front in a lot of regards to make sure we can, you have the funds to kind of execute the mission. But we're probably going to at some point kind of slow down a little bit as we examine the other funding opportunities to make sure we don't have that duplication of benefit. So with that, I'll turn things back over to John.
Sure. So thanks, Robert. I can certainly go through this. So there are some tenants that are required in order for public assistance funding to be approved. They're detailed here. So the key one that I'm seeing most often on this event is legal responsibility to do the work. So our cities and counties typically have jurisdictional responsibility to conduct these emergency protective measures, whereas private nonprofits, your food banks, your shelters who are out there may not have that legal authority. So you want to make sure that you have some sort of agreement in place in order to do to have somebody besides the city or county do the work if they're conducting that within your jurisdictional bounds. Documentation, it's going to be a key part of any part of the FEMA public assistance program. That documentation is the key part to, if you have something written on estimates, documenting it at the end and making sure that funding is part of the eligibility for the program, can be easily documented, and then make sure that you're able to retain those funds when we do grant closeout. Acquisition regulations. So your procurement is also important for this event. All procurement is being considered to be done under emergency or exigent conditions, which does waive some of the procurement requirements, but your local requirements are still going to be based on whatever your emergency procurement or your procurement policies state as you're going through the process. So you want to make sure that you look over any contracts you're entering into, large purchase orders, that you're meeting as much of the federal guidance that you can, even if it wasn't under emergency or exigent conditions, but also that you're adhering to your own procurement requirements. Duplication of benefits, Robert already mentioned that. Lots of money out there for this event coming from lots of different sources. We got to make sure that FEMA is the funding of last resort, and that they're only paying for something that nobody else already had funding out there to pay for. EHP requirements, if there is ground disturbing activities related to, if you have to do an alternate care site, or you're bringing in trailers for a non-congregate sheltering mission. If you do any ground disturbing activities, if you put it in a floodplain zone, there may be requirements there. So we want to be very careful of that. delivery of services to people with disabilities and AFN. We want to make sure that everybody is being treated equally there, and the cost share again, as we discussed earlier. So next slide, please. So California Disaster Assistance Act, Ryan covered this at the very beginning. Right now, it's only been authorized for the Great Plates Delivered program. If you aren't aware of what that is, it's an emergency feeding program designed to ensure that specified high-risk Californians receive restaurant-prepared meals. The current breakdown for this program only is 75% cost share from FEMA via public assistance, 18.75% is covered by the state under California Disaster Assistance Act, leaving a local share of 6.25%. At this time, all other work for this event is 75% FEMA share with a 25% local share. As Ryan mentioned, please continue to document your costs, and the CDAA for other projects for other localities will be assessed further on down the road in this event. So making sure that you document all of your costs clearly and are able to submit back will give the ability for us to review a request for CDAA with all of the information available. Next slide, please. So the application process for FEMA public assistance, for the most part, I think all of your cities have covered this. The way the program is administered is via the state through Cal OES, we're the pass-through agency. We disperse the funding down to the local level on a reimbursement basis. So as you expend funds, you provide a certification that this is the funding, the dollar amount that you've expended, and we'll have the state controller's office issue a warrant. And so this is the way it works here in California. It's a little different in other states, but that's how we process it. Next slide, please. So the streamlined application process. This is new for us, new for FEMA, specific to this event right now. You're going to want to start by going to the FEMA grants portal, which is at that web address located there. Most of your staff, if they've already got projects submitted or are documenting costs, will have already set up an account. You have to have one to be part of this public assistance grant program. Right now we have over 400 cities that have already applied for public assistance, which is great. That's a great number. We have over 2,000 applicants as well. But navigating through this portal can be challenging at times. Once you get into it and you figure out how it works, I think it's pretty simple. But there are a ton of how-to videos and quick guides within the grants portal. You can always go look there. They've included the helpline number here. This is a great shot of the landing screen. If for some reason your jurisdiction is one of the not 400 cities who has applied, you can go here and at the very bottom below where it says sign in, you can register your government organization for public assistance, and that's how you would submit an RPA and create an account all at the same time through FEMA. Just to be clear, this is FEMA's system. It's their requirement that we go through here in order to administer the public assistance program. But Cal OES has the ability to see and do almost everything on your behalf. And we have program specialists assigned to every single applicant in our state. You can find that information inside of your contacts for this event and reach out to them. They will assist you in any way that they can to make this, this process, I won't say painless, but as easy as possible. Next slide, please. Oh, and I think this is the one for Grace and I. So Grace, if you're okay with it, I'll start with the beginning and I'll give you the second half. So attend a virtual applicant briefing is the first step in the PA process. This is different than how PA is normally administered. It's usually got 20 steps across multiple different areas. FEMA's really streamlined it quite a bit for this one. So attend a virtual applicant briefing. We've conducted quite a few of those already. I think we did over 25. And again, had a huge turnout of numbers. From there, it's creating a grants portal account and submitting your RPA, which again, over 400 cities. I think we've probably covered everyone. Grace, you want to take it from here?
Yeah, sure. Thank you, John. So once you attend the applicant briefing, you fill out an RPA, what we call the Request for Public Assistance. And once that is received from the CalOES for the, I think they provided the contact information. Once that's received on their side, it's reviewed. It's a simple process on the side of the CalOES, but once it gets to FEMA for review, it's routed between an RPA submitted by, say, the government or school districts is a lot easier to review and double check the DUNS number to make sure we have the EIN number, and then we review it and approve it, and then you can start submitting projects. But if it's a PNP, we have another review queue that it goes through, which is the OCC or legal review, to make sure that the PNP is an eligible applicant or that we're not funding a foundation. So once that is submitted to us and you get the approval, you have access, and then you can go into the grants portal on your side, add or edit the point of contact information that you've provided. And once that's possible and you have the documentation or cost that you want to submit to FEMA, you can go ahead and actually start the streamline process. Prior to this process, we would assign you what we call a PDMG, who is a program delivery manager. And right now as well, we have a possibility to provide you a PDMG. And this can be a CalOES representative, it could be a FEMA representative. If you feel that there is a need for you to have somebody walk you through the program, we are available, we're ready to actually guide you step by step so that you can get the project through the process. And once you get the projects through, they go through what we call a CRC review queue. CRC receives them, review the documentation you provided. They write out what we call a scope of work. If you have sufficient documentation, the project is routed back to FEMA for a final review, and then to OES for a review, and then to you again to take a look at finally to say if you agree or if the work is captured correctly. If you feel like there is something that was not captured, that is your chance to kind of send it back so that we capture everything that you submitted on your behalf. But once that's done, CalOES, so if you sign off and you don't see any issues with the project, it goes back now to the obligation process. And CalOES routes it to us. FEMA does the final obligation, obligates the funds to CalOES, and that's where you take it on with CalOES to kind of get the funding from them. John will probably cover the process on getting how you get the funds from OES, so I'll leave that alone. But at that point on, John, you want to cover the funding before we move to the next slide?
Sure. So for funding, we're going to ask that you complete what is called a CalOES 132 form. That is a simple attestation of these costs have been incurred in this amount within this time period. Has to be signed by an authorized agent. And as long as those funds have been expended, you can be reimbursed on them as part of this program. At the end, when we do grant closeout, that's when all documentation will be required. We'll go through each of it and make sure that all of those costs that were expended were eligible, cleanly documented, clearly provided, and we'll submit it back to FEMA for their final review on it. I think we can go to the next slide.
All right, so for the next slide, and this one just captures like the issues that we are having right now. So because this is a completely new event that FEMA or the nation has never experienced, the entire nation, as you all know, was declared and actually eligible applicants. We have a lot of eligible applicants. For California on a whole, I think we have over 1,000, maybe say RPAs that have been submitted to date. So for the event, we're looking at like supplementing. There is a lot of policy that has been written and put out to supplement what we normally have. Normally, we only refer to the PAPA-G and say what we call 44 CFR. And the PAPA-G, I'm sorry, is like a public assistant policy that we all use, coupled with what we call the 44 CFR. So because most of the regulation and policy that was written did not envision or include such devastation, we have a number of policies or statutes that are out there to help supplement what our policy initially had. And inclusive of that, we have extra activities that have been added as eligible activities on top of what we previously had. The PNP eligibility have actually also been put out because the process right now is different. Initially, we had what we call critical PNPs and non-critical PNPs, and the PNP had to go through, a non-critical PNP had to go through the SBA application process. But because this again is different, we're not requiring that they go through the SBA application process. It's just like you have to fill out what we call a PNP questionnaire to kind of like, you know, provide the information for our OCC legal review. All right, so I'm sorry, yes, like Robert says there, like a PNP is a private nonprofit. I'm sorry, there is a lot of like acronyms that we're used to talking, like, please feel free to ask me if I kind of like use those a lot. We have what we call the procurement. John has already covered that. And if you do need any guidance on that, CalOES has a specialist that can actually reach out and tell you, kind of like, you know, talk to you or your team about procurement. We have the purchase and food distribution. John and Ryan have already covered this. CalOES has requested on behalf of the entire state food and distribution approval request that covers the entire California state. So if you have such costs, then, you know, the project is already covered. We're approving those time extensions in 30-day increments. And like John also mentioned, let's make sure there is a contract in place, an MOU if you're doing the distribution, the Great Place efforts that everybody's, other people are taking on. I'm not sure every city is doing the same thing, but you know, that's also approved, and extension was submitted to OES today. We have what we call the medical care facility policy that was put out. I know we have right there that it's in draft mode, but it's been put out and it's official. It's not in draft anymore. We have alternate care facility. We have non-congregate. So we have a lot of information that I cannot give you today right now, but please feel free to reach out to any of the FEMA representative, any of the CalOES representative that you can access. We'll provide you with the link, or we'll give you the information as hard copies for you and your teams. Next slide, please. All right, and this is the other one that, again, John, that touched on a little bit. Like, there is a lot of funding out there, a lot of federal agencies that also have the same funding, you know, that actually is taking care of the same things that we normally reimburse for. To mention but a few, we have HHS, CDC, USDA, you know, we talk about the CARES Act a lot. So there is a lot of funding right there, and FEMA's requirement, we cannot duplicate funding. And duplication of funding also includes insurance. If there is any insurance like reductions or coverage that is provided, FEMA will reduce the project cost by that reduction. So we're working in Region 9, we have a team, the IRC team, or long-term recovery as we normally know them. They're trying to work on a document to deconflict or kind of provide extra detail for all the existing funding that is out there. Once that documentation is probably finalized, we'll share that with OES or our representatives so that you guys get that information. There is a lot of questions still surrounding all these sources of funding. We cannot tell you specifically what, you know, is funding what, but we'll get you the details as long as you send us a question. We'll follow up and get you details, but we're working diligently to get you that information. All right, next slide, please. So eligible applicants, like I had mentioned, California right now, we have about 2,050 RPAs that have been submitted, including counties, cities, towns, school districts, and everything. So like I had mentioned earlier, PNP or private nonprofits are the only ones that probably have an extra review process. So they submit their RPA, fill out a PNP questionnaire, we take it through legal for approval, then it comes back to FEMA for final review. And then once that's approved, the applicant can go into their grants portal profile and submit a project. So once any applicant has been deemed eligible, for instance, right now we have 2,050, but of those 2,050, 1,800, I think off the top of my head, have been approved. So any of those applicants right now, we have about almost a few projects that have been entered into the system. You can go in, use the streamline process, and if you don't have access again, please feel free to reach out. We'll get you the contact information. We'll set up an account for you to access your account. we'll assign a PDMG or we'll work with you to walk you through the streamlined process. Right now, it seems like the streamlined process is a lot actually easier and faster because California has been working with a lot of disasters. But then I also recognize that there is a lot of applicants that are coming to FEMA for the very first time. So we want to recognize those, and those that need support, we are available to walk you through the process. It could be a little hectic, but we are available to provide you the support. Please don't feel overwhelmed. We have people on the hotline, we call the hotline, every time available as well. If you get a technical issue and you can't reach your PDMG or your Colliers representative, there is another number set up by headquarters for you to reach out and have them walk you through the system. If you have any issues, or because this is a new system that you think that maybe it's not working for you, there are a lot of glitches, we are actually here to take that feedback and work on fixing that to make this process a lot easier than it is right now. But I think with that, we'll move on to the next slide, which I think goes back to John.
Thanks, Grace. So, like I said, over 400 cities have already applied, but if you feel like you haven't applied for public assistance at this time, or you want to check with your staff, there are a few ways to do it. We showed earlier the grants portal, which is the grantee.fema.gov web address, where you can create your own application and your own account. It's the fastest way to submit a request for public assistance. However, if you have any challenges with that, or want to check on the status of something, this email address, disasterrecovery@caloes.ca.gov, that's our general inbox. That goes to all of recovery. It's monitored by multiple people. We are seeing a very large volume of requests right now, but we will get back to you as quickly as possible. That's also the main repository. If you have a policy question, if you have something that you need to run by us before you submit it, you're having challenges, you just need help, that email is the best way to get it to Cal OES, and we'll make sure it gets to the right staff member to be able to address. If you need to mail in a request for public assistance, we do still take them by mail, but you will have to process your grant through grants portal, but we can take it via the public assistance officer whose address is there. There is a deadline, there are multiple deadlines. The deadline indicated here is related to identifying your projects, your costs, the activities that are eligible emergency protective measures. You have to submit them within either 60 days of the declared end of the event or 60 days of the approval of your request for public assistance, whichever comes later. This falls in line with our list of projects or damage inventory timelines in the past. This event is weird. It's out of the ordinary for the way that we do things normally. So that's the date that's been established. Again, as soon as that declared end of the incident period is announced, we will scream it from the rooftops. We will blast every email we have. We will post it on our website. We'll make sure that everybody knows. Next slide, please. So free money always comes with strings. You may not have to pay it back, but you're going to have to do some other stuff along the way. So these are the responsibilities that fall to all of our applicants to ensure that you receive public assistance funds and that you get to keep it at the end. So we want to make sure that all of your payment documents, all of the cost documentation has to be submitted to us. You're going to provide it to Cal OES. We're then in turn going to provide it to FEMA. For every project and for all costs that you're trying to claim. There are exceptions if we're talking about tens of thousands of line items of personnel records. I want to know that you have all of them, but I'm going to come and do a sample, and I'm going to send a sample on to FEMA, and they're probably going to do a separate sample. So even though I don't want to have 10,000 line item records of your time, I need to know that you have them, and I get to pick which ones I review and audit, and FEMA will do the same. The grant funds have to be expended in accordance with the grant requirements. That's pretty standard for any public funding grant. You're going to be accountable to the state for federal funds. If something goes wrong, if there is more money that's turned out to your organization than is deemed eligible at the end, those funds are going to have to come back to Cal OES so we can return them to FEMA. And we're going to ask that you maintain clear and organized documentation. There are some forms included, but for the most part, we're going to have You document it to the best of your abilities under the normal circumstances that you do it, and then we're going to try to fit that into to show the documentation for our own program and for FEMA. There are some summary sheets that we like to use. Anytime you've got an organization who's running an EOC, they always ask, hey, do you want our ICS 214s? Yes, I absolutely do. That's a great piece of documentation, but it's that type of thing along the way that we're gonna wanna see. Next slide, please. So best practices, it says they're continuing through May 21st. They did continue all the way through there. We are in the process of trying to edit down our briefings to post a recorded version on our website. We want to make sure all of your funding forms are submitted. Getting the request for public assistance in is the first step in the process, but in order to receive payment from Cal OES, there are other forms included, which we've discussed in our applicant briefings. They're provided on our website. They're also provided anytime we give you a notice of obligation. It's going to have a copy of those forms if they haven't been provided to us already. Procurement, it's the #1 thing that leads to deobligation on most events. Even on this one, under emergency and exigent circumstances, document how you did it. Make sure that you follow your own procurement guidelines. If you're paying an exorbitant price for PPE right now, but that's the best price you can get, document it as you go. That's the type of thing we want to see, to make sure that you didn't just go with the first one you got, but that you had some reason as to why a 40-cent N95 mask from December now costs us $5 a piece. Environmental, we talked about that already, and that cost documentation, I can't emphasize it enough. The better your documentation is, the more likely it is that you're going to be able to capture the greatest amount of cost reimbursement. Next slide. Oh, and I think this goes back to Casey.
Yep, so I can take this one here. So I'm Casey Deshawn, the Congressional and Legislative Affairs Liaison for here at FEMA. And I know as we're wrapping up the presentation here, I'll be real quick because I know we have a bunch of questions in the queue. We'll try to get to as many of those as we can. But we did want to add a few helpful links to the presentation in case later down the road you all have questions. You can access this as a kind of a cheat sheet to get additional information. Quickly, the first link there, Federal Public Assistance Program fact sheet, that will link you back to the FEMA website. There you go, and we'll provide you with just kind of a general overview of the public assistance program. It also describes the other various categories of the public assistance program, but as was mentioned earlier in the presentation, only Category B is eligible on this disaster. So if we go back to the slide again, the second link there is the applicant briefing public assistance helpful resources. If you could click that, please. And that is a Cal OES website, kind of a clearinghouse of various information that applicants, sub-applicants can access regarding the public assistance program, how to log into the FEMA grants portal, as well as getting other miscellaneous various information that may be needed or in their application, or answering questions on specific items that might come up about whether or not they're eligible or ineligible. And then if we could go back, the third link there is the Cal OES Recovery COVID-19 Resources and Documents website. So this is a general clearinghouse recovery website that Cal OES has set up that has all the other general information associated for the recovery process related to COVID for Cal OES and for the applicants. It's not quite as detailed as the previous website, but it does contain a lot of quick information about the key parameters of this particular disaster. And then if we'll go back to the last one, is a FEMA link for COVID specific related information. It's a FEMA website where we have created a site where we've kind of stored all the disaster specific guidance for this disaster related to COVID-19. And on there, you'll find our guidance that was created by our headquarters that highlights some of the parameters of our non-congregate sheltering program, emergency feeding program, as well as a description of various emergency protective measures that could be eligible under our public assistance program, and allow you to take your time at a time that's convenient for you to look at that if you have any additional questions. So with that, I will turn it back over to you, I guess, Derek, and if you want to moderate the questions, however you want to do it, live or the Q&A, we'll go from there.
Great. Thank you so much, Casey, and thank you to everyone who was participating in the call today. We do have quite a few questions queued up in the chat box, or excuse me, in the question and answer box. We'll do our best to get to as many as we can. Want to be respectful of our speaker and your time today. So if we aren't able to answer any questions, please make sure that you reach out. I believe the CalOES and FEMA provided in one of their slides the disaster recovery at caloes.ca.gov email address. Please follow up with them there. We would be more than happy to get back to you as soon as they can. So with that, I'll kick things off. There's several questions that we received in the chat from a couple different people regarding reimbursements for various things. So one of the things we got several questions on was if you go back to the FEMA PA COVID-19 slide, it discusses security and law enforcement as one of the things that is reimbursable. And so people were asking, does that include law enforcement? And if so, what parameters around that? Is that their salaries? Is that other things that law enforcement do? So if you could get a little bit of clarity on that, as well as folks had questions regarding staff salaries that may have worked on something related to COVID-19 in the city and or were deliberately not working on something because of COVID-19. So question kind of about security and law enforcement on one end, and then about staff salaries on the other end. So if someone could address those two for our first question, that'd be great.
All right, I'll go ahead and take that. So it's this event is what we call emergency protective measures, and I think law enforcement and all of that falls under that. So most of our emergency protective measures, FEMA will only reimburse for overtime, or if we go to employees that are probably being called off of their, like, say, leave or vacation time, that's when maybe we'll get that time covered. Or if we bring in people, folks that are not scheduled to work, that's why we'll cover like different kind of time. So I guess the general question is like, what is reimbursable? Salaries for folks that are already budgeted employees, that's not going to be something that we reimburse for, because we are under the assumption that those folks are always or are at their duty stations or are doing their regular jobs that they're required to do. But if you call in extra reinforcement or you hire temporary workers, those are employees that we can pay for the straight time and the overtime included. So I'm not sure if that's a brief response, but I think that will cover law enforcement.
Great.
Do you have any additions?
Anyone else have anything else to add? Okay. And like I said, if your question wasn't answered or you want to have more detailed follow-up, please do email that disaster recovery, one word, at caloes.ca.gov if we don't get to your question today. So the next question I want to ask, Sarah has a question that says, when and how will the decision be made for the state to cover the 18.75% cost share for FEMA PA eligible costs?
Yeah, so that's talking about California Disaster Assistance Act funding. So for anything other than the Great Plains program, like I said, we're going to ask that you collect up your costs and submit a request as we get to the end of this event to make that determination, and it'll be done on a case-by-case basis.
Great. Thank you for that. Let's see here, trying to see if I can capture questions that multiple people have asked. Nina has a question that says, will you describe with a detailed example of what good cost documentation includes?
So from my perspective, as in grant closeouts, we don't really have a specific example. It's going to be as detailed as you can. General accounting principles usually come into play there. what I try to think about, and as my partner here in the room had said, think about it as an audit. The documentation that you would want to be able to provide should you be audited, because that can happen. It can happen on any project. It can be done by the state or by FEMA's Office of Inspector General. At minimum, like for example, let's talk about force account labor. We want to see the person's name, the hours they worked. We're going to want to see if we can only claim their overtime. We're going to want to see their straight time to establish their overtime. We'll need a copy of the pay policy. We want to know what type of activities that they were doing. So unfortunately, it's not necessarily one size fits all, but the more detail you can provide, the better chance you're going to have of capturing that full reimbursement.
Thanks, John. Okay, we have a couple questions here related to timelines. So Rebecca asks, when submitting costs for reimbursement, are we to have the projects 100% accounted for and done before submitting, or will you accept rolling ongoing requests until 60 days following the incident end date? So can we set up a project online and then keep adding costs to it? And then related to that question, Jay also asked about cost reimbursements must be submitted now unless we have funds. In this case, it's limited to 50%. Otherwise, we can wait until the end of the disaster or submit our costs within the 60-day end of date time limit, correct? So I think if we could clarify a little bit about that 60-day window and some of the reimbursement rates.
All right, so for the reimbursement, FEMA normally categorizes, we have what we call projects, and reimbursement is done. You can submit a project that has been completed, so you can wait until you get your documentation. I would recommend that we wait till the end, because most of the time the assumption is that somebody's going to wait until they get all the documentation, and then that ends up taking forever. But yes, we have what we call a standard project, an expedited project, and a completed project, which is work completed fully documented. So for instance, for an expedited project, we've allowed for, like, say, if you have to purchase like PPE, we're allowing that you submit an estimate, have enough detail in there. If we can get the contract that you have in hand, submit that to your, maybe through the streamlined process or through your representative of CALIES or FEMA, and then they will write what we call a expedited project, but it goes off 50% funding. So you get 75% federal share of the 50% cost that you've submitted. And once that is sent to you and obligated, so it goes through the system with limited amount of documentation required. So, but once that is finalized and say you're done with those purchases and you have all the details, you would come back then to FEMA or OES and submit the remaining documentation that provides full detailed invoices and everything that you purchased. And then we'll version that project to give you the 50% or the 75% of the 50 that was remaining. So that is one route to take if you need funding right now and need funds sent to you or obligated to you right now. That's the way we're kind of, FEMA and OES is kind of working together to get funds out to folks that need the funds right now. But then we have what we call a standard project, and that's like normally if you didn't want expedited funding, but you have a project right now that you're working on and you have the full, like say 30-day estimate out, you can send the same estimate to us, but we write it as 75%, but then that's going to take a little bit longer because we're going to require all the estimate, like, you know, maybe supporting documentation and just probably all the detail describing what you're doing in order to get it through the review queues. So then we go to the third one, which is work completed, fully documented. As it says, it means that you've already completed this work. Maybe say you provided like support or EOC, you know, you set up an EOC and you've already incurred the cost. So we expect to get all the time cards for all the employees that were at the EOC. We want to get all that backup documentation when you submit that project, then that project is routed through that funding. But then when we talk about, I think, I'm not sure I covered the second question, but the second question, I'm sorry, what was the second question? I went on for a long time.
No worries. Here, let me just pull it back up. I think it was discussing no cost reimbursements must be submitted now unless we need funds. In this case, it's 50%. Otherwise, we can wait till the end of the disaster for our costs within 60 days of the end date. Is that correct?
That is correct. And then I think, yes, normal funding will go through, like, say, once you submit your project, and I think we go back to the timelines because, again, this event is unprecedented. We normally would have had, like, say, once you get an RSM is done, you have 60 days to provide us a damage inventory to show what cost you are requesting, and then we'll give you like 6 months to complete that work. But because this event is still open from covering costs from incurred from January 20th and still ongoing, the timelines are going to be once the incident period closes, 30 days after that, we'll continue getting RPAs, but then the cost that the projects that are submitted, I think we don't have a time limit on them. I guess once, John, help me out here. I think I'm kind of like lost in there.
Sure. So the key item is that we really want to make sure we don't miss that 60-day deadline after the incident period is closed, because FEMA has the ability to say, nope, we won't take your project costs because you didn't submit them to us within that timeline. So if you have costs now that you can estimate, that you can put forward, we're making the recommendation to try to get those projects identified and submitted. But certainly you can wait until the end of the event. That's going to set that end date, and you'll know all of your costs inside of the incident period at that time. Just be very, very careful about that 60-day timeline. We don't want to have to be in a position to say, hey, it's day 61. Can we please have permission to submit this?
Yeah, and just so we're clear, because I'm the one that authorizes extensions aren't going to happen. So you heard it from me direct. We're going to take a firm stance on ensuring that we're adhering to the timelines of the program. This would be the time now to be submitting projects if you can, so we can turn that around, because as mentioned, the entire country is activated for public assistance. So you can imagine, as we get close to the end, we're going to do our best to obligate projects and get through them. But we don't want to be at the end of once there's a deadline for this, which will come at some point. We want to get those projects in. But our feeling is everybody knows we have a nationwide disaster. Everybody knows that we have FEMA's been activated. And through outreaches like this, we want to make people aware of the program and the deadline, so nobody comes in once we have a firm deadline, which maybe we'll do another webinar once we have the deadlines in place to explain the process, that we want to get all that in so we can expedite and obligate as much federal financial assistance as we can to our FEMA authorities.
Well, hey, you heard it here, folks, straight from the source. Make sure you get those things in within that 60-day time frame. I'm just glad we have such experts on the phone to answer these questions, because I mean, goodness, this is very complex. So thank you all for really making it digestible and kind of walking us through that. Like I said, I want to be respectful of everyone's time. We're 3 minutes over. I think I'll take one more question if that's okay, and then we'll wrap up and thank our wonderful speakers. And like I said, my third time plugging this, if your question was not answered today, please disasterrecovery@caloes.ca.gov if you have more questions or want more detail. So our last question is for John. It says, should we strategize lumping projects into fewer larger projects rather than all small projects? Small projects help us with reconciliation once obligation payments are made, but we understand this may be more work for CalOES and FEMA's end to filter through rather than a few large projects. Any advice would be much appreciated.
That's a great question. My take on it would be you do what's best for your jurisdiction. We got plenty of people here working. We're going to tackle it to the best of our ability. So don't worry about how you couch your projects for our ease of administration. Do it for your ease of administration. You want to make sure that you have it lumped into logical, segregated projects if that's the way you decide to do it. Certainly larger projects are easier there is a threshold associated with projects. There's a designation between a small project and a large project, which is $131,100. If you exceed that dollar amount, FEMA's going to reimburse you on actual documented costs. If you are under that threshold, you're going to receive the funding that they approve for that amount. And it's going to be based off of the documentation that's provided at the time. Basically, you can do it either way. My recommendation is whatever is going to assist you at a local level to make that work most easily, as long as you're not segregating, these are masks and these are surgical gowns. Well, we would say that's all PPE. We'd probably ask you to put all of that together. But otherwise, try to do it to make your ease of administration better.
Great.
Unless, of course, my FEMA partners disagree.
They're shaking their head, so I think you're in agreement there, John. So thank you once again, John, Ryan, Robert, Grace, Casey. Thank you all so much. We really appreciate you taking the time today to speak to us, and we really appreciate all the help that you're doing for our cities. And like I said, you'll definitely be hearing from some of our members soon. If you haven't already started to hear from them throughout this webinar. And if there's anything as far as information goes, I know that you were talking about screaming things from the rooftops. Well, please, if the league can be helpful, we're more than happy to help push out information on this very important topic. So for both for FEMA and for Cal OES, do use us as a resource as well. So thank you all. We really appreciate it today. And that concludes our webinar. Everyone have a great rest of your week, and we'll talk to you soon. Thank you.
Thank you.